Okay. Welcome everyone to our August webinar on home dialysis. Is it your best treatment option? My name is Kathy Nickham and I'm the Education Director for the DPC Ed Center. And we have a couple of housekeeping things that we need to go over just before we start. Hillary, could you do the next slide, please? Thanks. So all of your lines are muted, as Hillary said, and if you have a question during the program, feel free to use the chat room. Otherwise, we will open it up for questions at the end of the program, and you can unmute your line by doing the #6 and then muting again by doing *6. We are recording the webinar, and the recording and the slides will be available on our website. And we hope that each of you will complete the feedback form at the end of the program that will come up. That certainly helps us know what kinds of programs you'd like to see in the future. And we encourage you to share the information from this program with others. And again, we invite you to join us next month for our webinar, which will be on communicating with your healthcare team, some top tips to prepare for visits and partner with professionals. So it is my extreme pleasure to be able to introduce our two speakers to you today. Dr. Michael Kraus is a nephrologist, a wonderful nephrologist, I might add, from Indiana University School of Medicine. He's also the Associate Chief Medical Officer for Next Stage Medical. And Vanessa Evans is a Patient Advocate Manager for Next Stage Medical, and she's a dialysis patient for 20 years, the last 13. She's been on the more frequent home dialysis with Next Stage, and you'll hear her story during the presentation today. At this point, I'm going to turn the program over to them. Dr. Kraus.
Thank you, Kathy. I'd like to thank everybody for attending the conference today. Just getting my slide here. And it's a pleasure of both Vanessa and I to speak with you and speak together about home hemodialysis. We are quite aware that many of you are new to the thought process of home hemodialysis. Some of you may even be on home hemodialysis, but we want to get a conversation going so that all of you can understand why to consider it and why to consider how we do home hemodialysis today, which is frankly different than it used to be. So our agenda is fairly straightforward. We're going to discuss treatment options for end-stage renal disease or for kidney disease. We're going to discuss, I'm sure, an important question for all of you. Why would I possibly want to dialyze more than 3 days per week? And why would I want to do it at home when there's a perfectly good center? Then we'll go over Vanessa's story. She'll share with us her life story with renal failure, which is very interesting, and I'm sure you'll enjoy. And then there'll be plenty of time at the end for questions and answers. And again, when we get to the question section of the program, you can either use your chat function or you can unmute your line with the #6 function and ask a question live, whichever you're most comfortable. If you prefer to write questions during our presentation, feel free to send them to the chat, and Hillary and Kathy will be collecting them, and they'll put them together at the end for us to discuss. We won't address them while we're going on. So a good question for all of you, and of course I don't want you to unmute, tell me now, but just think about what is your current dialysis therapy. We anticipate there's many of you out there that just have chronic kidney disease, or maybe have a loved one with chronic kidney disease who does not yet require dialysis. And I suspect there's patients out there who are on in-center hemodialysis, peritoneal dialysis, and even home hemodialysis. When we look at the country, when we talk about going into dialysis, we know that approximately 88% of the country is on in-center dialysis, 10% of the country is on peritoneal dialysis, and 2% is on home hemodialysis. So we anticipate that our audience today is somewhat like that. So as we develop renal failure and end-stage renal disease, a question for your nephrologist is, hopefully even before then, or as you progress in chronic kidney disease, what are your treatment options? What can I do to help care for myself so I can have as normal a life as possible and as long of a life as possible to enjoy the time so I can work if I desire, spend time with family, and travel and do all the things that I did before I had renal failure, because that presumably is the goal that we all have. So today there are a number of options available to you, and hopefully tomorrow there'll be more. But presently today there's in-center hemodialysis, and in-center hemodialysis is typically what most people think about when they think of dialysis. That's in the clinic where you'll have a nurse and a few technicians, and they'll be able to take care of a number of patients 3 times a week generally, and the average time in the United States is about 3.5 to 4 hours. This is a clinic setting. They take your blood out of your body, run it through a filter on the dialysis machine, and in that way they're able to take off the extra salt and water, they're able to take off the excess poisons that we make every day as we live and breathe. Another option is peritoneal dialysis, which is generally done at home. And peritoneal dialysis is a different form of dialysis in that they place a catheter into your abdomen or into the peritoneal cavity, which is the balloon around your intestines and liver. So they've got a dwelling catheter there all the time, and then you will infuse a glucose salt water through the catheter into your peritoneal cavity or the balloon around your intestines, and salt and water will go into your body that you need, and poisons and excess salt and water that you don't need will go out of your body, and then you'll dump that out through the same catheter and then fill back up. That can be done during the day, which is called CAPD, or ambulatory peritoneal dialysis, or it can be done with a machine while you sleep called CCPD, or cycling peritoneal dialysis. The next option, which is available and one we're going to spend most of the time discussing today, is home hemodialysis. And home hemodialysis, you use that hemodialysis, meaning the blood going out of your body, run it through a dialysis device, and you do it much like you would in the center. You're trained, you do your own cannulation or placing of the needles, and you're trained to be able to perform this dialysis simply and safely in your home. And then the final option is kidney transplantation, where we take a kidney from somebody else, either living or recently deceased, and we put that kidney into the patient, and they take medicine so they don't reject or lose that kidney, which is clearly still the best option that we have available, but not always available to all of us. And we know that in the world today, in the United States today, about 25% of the people are touched with transplantation somewhere in their SRD course. Vanessa, she's going to share with us her entire story, but which of these options have you experienced to date?
Sure. So first of all, thank you so much for having me. I'm really excited to be here and share my story and answer questions, because as a patient, I know that this is overwhelming and daunting. So I actually did in-center for 8 years and then found out about home hemo and transitioned to the Next Stage machine. I'm actually going on 14 years now with Next Stage, but I actually did also have a transplant before I started even dialysis. And so I've actually done, out of these 4 modalities, I've done 3 of them. So I certainly can talk to people about all different aspects of dialysis.
And that's an excellent point, Vanessa, because a patient doesn't generally just experience one of these therapies.
Right.
Patients will experience 2, 3, or 4 of them, and you yourself has gone through 3 of them.
Exactly, and I think it's an important fact for patients to understand that, yes, kidney transplant is an option, but it is another therapy. And as much as we would love our transplants to last for the lifetime, that we live, often enough, they might not last that. And so it is important for a kidney patient to be educated on all modalities and to know what's best for them at that certain time in their life. Because, over your time span and life, things change, and you might have different needs and different family that can assist and not assist, and you yourself might be healthy or not healthy, et cetera. So it's really important for a kidney patient to understand that there are options, and just because you do one option now doesn't mean that you can't transition and then do another option later.
And for you patients out there, as you think of your questions or what you want to get out of today's hour, Vanessa, as she said, has gone through 3 of these, so she can give you the patient's experience directly, at least as she experienced it. I've been a nephrologist for over 25 years now, and it's taking care of many patients of all forms of therapy and worked with transplant in-center, peritoneal, and home hemo. So hopefully we'll be able to answer your questions. My slides have disappeared. There we are. Good. They're back. Good. Hoping it wasn't just me. So we'll go to the next slide then. And we're going to then move on to one of those 4 forms of therapy, and then one we're going to spend the time of today is more frequent home hemodialysis. And again, there's a question that pops up there, more frequent. Why, Dr. Krause, I know that if I go to in-center, I get dialysis 3 times a week. Why in my home would I want to do more than 3 times a week? And so we'll begin to go through that. So hopefully you will get an understanding, but certainly ask those questions. But we're designing a therapy for the patient, in my opinion, and I've been working on increased frequency home hemodialysis for 15 years now. Designing a therapy for the patient which is flexible, portable, simple to use, but gives you benefits of renal replacement therapy above and beyond what you generally receive in center, so that our goal is that patients at home feel and act normal. They of course have the interruptions of their life of dialysis and the interruptions of all the schedules and getting all the supplies and things, but the benefit of that is the payback is a more normal life, feeling better, doing more, being more active. And that's our goal. Certainly my goal as a physician, and Vanessa, I suspect that's your goal, and that's why you continue to home dialysis.
Absolutely, and I know we'll talk directly about my story in a little bit, but I just do want to stress that one of the biggest benefits, and we talk about the frequency, is, the kidneys function 24 hours a day, 7 days a week. And so really from the first week that I transitioned over to next stage with the more frequent therapy, I felt the benefits really within the first couple of days. And one of those benefits actually was reduction, and then eventually I got off all my blood pressure pills. Because doing the 3 days a week was simply not enough, even though I was very good at following the prescription, and I did my treatments and was very careful with what I ate and what I drank. It was still hard to be able to maintain balance and be able to have good blood pressure doing the 3 days a week. So I can tell you that for myself, the benefits of doing more frequent really resulted right away in lowering of prescription, and then actually eventually being able to be taken off some of my prescriptions, which is a huge, not only clinical benefit, but it's a lifestyle benefit in terms of all the medications that you have to take, the way some of the feelings that you get with taking these medications. Sometimes you might have, headaches or different results that happen with taking medications. So it was a big difference for me just to be able to transition and being able to take away some of these medications.
So as we move to more frequent, and then the question goes, why home? And I'll bring up a point just in case some of the patients out there are already on home hemo. The device on this prior slide is the newer cycler, so it probably looks different than what's in your house because I don't think we have those in homes yet, but that's coming. But the cycler that most of us are used to, and the cycler, if you go to your doctor today and ask, can I do home dialysis, would be the one there that Vanessa's actually hooking up right there in the picture to the left, and in her living room on the right there. And so the question is, can I safely do more frequent dialysis home, and why would I want to? And I think let's go ahead to our next question to ask yourselves. This is a good question. We've seen all this, we've seen the commercial that says, did you know diabetes affects your heart? No, the question is, does dialysis and end-stage renal disease, does that affect your heart too? And we'll see that it is. I mean, end-stage renal disease is a cardiac disease, and patients' hearts, unfortunately, worsen the way we take care of them on thrice weekly dialysis over time, we tend to get bad blood pressure, sometimes difficulty with hypotension, and we'll discuss some of those things, but you develop a cardiac disease that's associated with renal failure that most of us don't think about. So when I think about taking care of patients on dialysis, I think about taking care of their heart more than I actually think about taking care of their kidneys, because taking care of those kidneys is the technically easy part. Taking care of the heart is the important part that's going to keep my patients out of the hospital and alive longer. So as we look at more frequent dialysis, and I think one of the beauties of doing more frequent at home is it opens up the time and the ability to do a more frequent dialysis. I'm not sure we can afford to do more frequent dialysis for everybody in center, but I can do more frequent dialysis at home. Plus, then it's on my schedule as a patient, not on the doctor's schedule or the clinic's schedule. It's not as rigorous. So you can do it in the morning one day and in the evening the next day if you have something to do in the mornings. So doing dialysis 5 to 6 days a week is more easily done at home than it would be in center. And the reason to do more frequent dialysis is because we are treating the dialysis patient as a heart patient. We're doing the best care we can for their heart. So by dialyzing people 5 or 6 days a week versus 3 days a week, multiple studies have shown marked improvement in pressure, and that's not only the blood pressure is better, the number of blood pressure medicines the patient takes goes down. As Vanessa told you, she's now off blood pressure medicine. When you started, Vanessa, how many pills were you taking for your blood pressure?
I was probably taking 2 different pills a day, and I also found that even, one pill would work for a while, and then we'd have to change it, and I would end up on a different medication. And so there was a lot of back and forth of always trying to find the right medication for the blood pressure, which resulted in probably 2 pills a day. And like I said, I was a very compliant patient. I was very careful about what I ate and what I drank. It was just simply the fact of just the frequency of the therapy was really not enough. And it wasn't until I had more frequent therapy that I actually understood that and felt the difference of being able to do more dialysis, and then therefore was able to get off all the blood pressure pills actually within a week of starting more frequent therapy.
Excellent. And I don't know if you had this, Vanessa, but many patients experience what we call intradialytic hypotension. That means they'll come into the dialysis unit or live normally throughout the week, hypertensive, having high blood pressure, but during dialysis they'll drop their blood pressure. Some of them may even drop their blood pressure enough that they lose consciousness. So the beauty of doing dialysis more frequently is not only do I control your blood pressure to a more stable level and likely off most of your meds, but I also don't get that hypotension that we see with the only 3-time-a-week dialysis. By removing fluid in smaller portions every day, we're able to get your blood pressure to a normal level and without the lability that we see or the variation we see in blood pressure on 3 times weekly dialysis.
Right.
In addition, phosphate. If you're a dialysis patient, you know about phosphate as well as I do. It is hard to get it out of your diet. It's in almost everything we eat. And then we give you binders, which are pills to reduce the phosphorus in your diet. These binders have some GI side effects, and frankly, they're quite expensive too. And one of the major costs of caring for patients today is treatment of their bone disease and their phosphorus. By doing more frequent dialysis, we do decrease the level of phosphorus in blood. We sometimes decrease the number of binders. I think if we move that more frequent dialysis to 5 nights at home instead of 5 days shorter, we do longer dialysis while you sleep, you can be completely off your phosphate binders and have a normal diet. You don't have to restrict phosphorus to the degree that the average dialysis patient does. So more frequent dialysis, particularly if we move it to the night, will allow a much better control of hyperphosphatemia, which is also associated with heart disease. And when we talk about the heart, sorry, Vanessa.
Sorry, Dr. Krause. I just wanted to I just feel like you're making such wonderful points, and I think one of the things that patients all can relate to is not only the phosphorus that you were speaking about, but kind of the low blood pressure feeling that you were talking about after a treatment. And I know just from my own experience that there were many times, luckily I never passed out, but I did have very low blood pressure, and I'm sure a lot of dialysis patients are going to relate when I say you have cramping, you feel nauseous, you feel kind of out of breath and low energy. And all of those things do disappear with what you're talking about now when you start doing the more frequent, because you're doing a little bit at a time and you're not having those crazy extremes of trying to take off so much fluid in such a short amount of time. And I just think that's so important for patients to realize, because as we talk about the frequency, and you've touched about, like, why would I want to do this more often? I already don't like going 3 days a week. And I was one of those patients. You know, I didn't like going 3 days a week. But it's so important for patients to understand that the frequency of the treatment, what is so important, is where you're going to get those clinical benefits of not having those highs of blood pressures and then lows at the end of the treatment. Not to mention, when you're doing a little bit every day over time, that middle molecule that you're talking about now, which is the phosphorus control, being able to control that. And these are things that patients, you know, we understand, but not really. We just feel the side effects of kind of what's going on. And if we can understand the education of what goes with it, I think patients will understand why it's so important to have that frequency, and then being able to do it at home kind of just makes it that much easier, because you then get the benefit of the therapy with the clinical benefits as well. And I just wanted to make sure that I relayed that, because as a patient, you know, we hear all kind of the highs and lows, but to understand the education behind it is so important.
I agree, and you bring up some very good points. I do have a question for you, and I've never asked you this before, so I'm putting you on the spot. You've been on home hemo now for 14 years, and you said that you had hypotension during dialysis when you were on thrice weekly. How many times have you felt that you had to, your blood pressure was dropping and you felt uncomfortable doing dialysis at home over the last 14 years?
Honestly, I mean, probably never. And I'm not saying this to say it. I just, I think that when you start to do dialysis at home, you're so in tune with your body and with what's going on. You become a better patient because you understand. And because I'm doing this therapy so frequently, when I was in center, I was pulling off sometimes like I think 1.5, even 2 kilos, which is a lot for me. If people know me, I'm small. I'm 5'1", I'm maybe 115 pounds or so. So that's a lot of fluid for me to be pulling off. Now when I'm doing it at home more frequently, I mean, the most that I usually take off is like 0.5, so not even a kilo. So I really don't feel those highs and lows anymore. That has completely disappeared from me. And patients probably don't understand that feeling because they think that it's just part of normal everyday dialysis, when actually that feeling of feeling nauseous and cramps, I've never had leg cramps or anything like that at home. I just haven't had that problem, only because I'm not pulling off so much fluid in a short amount of time, and that makes a huge difference.
Yeah, I think that's an important point. It points to the safety of doing dialysis more frequently at home. I would anticipate that if I were a dialysis patient and I had trouble in center and I dropped my blood pressure a couple of times, I might say, gee, I don't want to do this at home. But the point is, A, we train you to do this very well, and B, we reduce these problems so they're well controlled, and we hope that you don't have to worry about experiencing them at home.
Exactly, and I've spoken to a lot of patients where that's obviously a number one concern is, well, what if there's an emergency? And the truth is, a lot of those emergencies sometimes are related to a blood pressure drop, nauseous, and not feeling well, removing too much fluid. And so by doing more frequent dialysis, you really do take away kind of that piece of it, because that, at least that piece of the blood pressure dropping and not feeling well really goes away when you're doing more frequent.
Very good. And so we'll move on quickly to finish off the slide, because I think Vanessa's got a next slide coming up that's very nice as well. But this 2-day skip is an interesting question. Patients look forward to their weekends off dialysis. So it's Friday, they're happy that they're not coming to dialysis for 2 days. Unfortunately, when we look at the dialysis population, the 2-day skip ends up putting more patients in the hospital with heart failure and arrhythmias and problems with their heart, as well as, frankly, having sudden death and dying on Monday after midnight due to this extra pressure we put on the heart with increased salt, water, and poison because we skip more than one day. So one of the beauties of more frequent dialysis is there should be never a reason that you skip 2 days in a row. And you'll get used to that, and you feel better, so it doesn't feel as bad as it did when you did thrice weekly dialysis and you felt more poorly. And then by doing it more often, as Vanessa's already said, we're taking off fluid slower, which is this ultrafiltration rate. That is clearly associated with what we call cardiac ischemia during dialysis. So the heart actually gets what we call myocardial stunning, or you have small little heart attacks every time you do dialysis, or potentially every time you do dialysis. By doing it more frequently with less fluid coming off, as Vanessa said, you can make that disappear as well. And finally, many of our patients, about 3/4 of them, may have what's called LVH, or left ventricular hypertrophy, which is a long term for a thickened heart. And as you could imagine, the heart is just a pump. When it thickens, it doesn't work as well. It gets more risk for fluid overload, more for heart attacks, and more risk for heart rhythm disturbances. With more frequent dialysis, 5 to 6 days or 5 to 6 nights per week, the thickness of the heart actually improves. And that's the only thing we've ever done with renal failure patients on dialysis that's improved that thickness, is by just increasing the frequency of dialysis. And it turns out, if you have a thick heart, the thicker your heart is, the more response you have to more frequent dialysis. So that's an excellent question, or some thought to think about as you talk to your doctor and they visit you with your dialysis treatments today. And then, sorry, Vanessa's next slide, I forgot this one was here, but we think, at least as we practice medicine today, people that do 5 to 6 day a week dialysis at home actually have a better survival than patients do in center. So if you look at 5-year survival, the sad truth is that 40% of the people that start dialysis today will die within 5 years on thrice weekly dialysis. With PD, especially the first 2 years, that is improves. And then as we practice home hemodialysis in the United States today at 5 to 6 times per week, that mortality is actually better and approaches that of transplantation. And this is, I'll let Vanessa speak to this one too, because this is an important patient one, but you just don't feel good. So Vanessa, after thrice weekly dialysis, how long did it take for you to feel well?
So I used to go to in-center dialysis at the 3 o'clock shift, because I would teach actually during the day. And then after my treatment, I was wiped out. I was completely exhausted. And honestly, I would come home and eat a little something and get into bed. And it basically took me all the way till the next day. So I would sleep. So it's a 10-plus hours until I would feel better, and sometimes not even great in the morning, because I felt still kind of maybe low blood pressure sometimes in the morning. And so the recovery time was quite immense, and it would vary each time after treatment on how much I was taking off and how I felt, et cetera, versus now doing home dialysis and doing more frequent dialysis. I don't have any recovery time, to be honest with you. I mean, people that know me know that I will dialyze, and then I, wait till I start bleeding, and then I can go on a walk. I can go to a conference, go to work. I end up just kind of going about my day. So although, and you alluded to this in the beginning, although, we have to take time out of our day and make sure that we do our treatment, and that's a whole other piece that you have to think about how you're going to put it in your day. The truth is that the recovery time is none. I mean, for most patients, you feel pretty good when you're done. I would say less than an hour for anybody.
And exactly, and studies have shown that. So this is an important point for many reasons. One, most people that I talk to on in-center dialysis say, doctor, I feel bad for 6 hours after dialysis 3 times a week. Why would I want to do it more often? This certainly is a concern, and it's a good concern, because you shoot a whole day with dialysis between dialysis and recovery time. The truth is, with 5 or 6 days per week, that recovery time goes to an hour or less in the bulk of our patients. So that recovery time buys you time every day, but it turns out it actually buys you time in your lifespan. So every hour of recovery is associated with increased risk of death. So 1 hour recovery time has a 5% increased risk of death versus none. So if you have the mean of 6 hours or so, that's a 30% increase in risk of mortality that goes away with more frequent dialysis. So the recovery time goes away, which improves your day-to-day life, and it's our hope it also improves your long-term survival. And interesting enough, patients feel better and they do better, and it turns out people that do home hemodialysis have a higher rate of transplantation, especially if they weren't listed before they started dialysis, because they stay healthier, they get healthier quicker, and the transplant programs are more likely to transplant them in a healthy state. Now, this is a slide for Vanessa. This is a great slide as well, and Vanessa, if you don't mind, I'd let you speak to it.
Absolutely. Okay. So, I mean, we've been alluding and talking about this kind of throughout our presentation today. But again, I always just want to stress from a patient's point of view, because in the end, I'm a patient, and I've been a patient for 21 plus years. The last 14 doing more frequent with next stage. I mean, my life completely changed when I went on the next stage machine. And I honestly thought that I was feeling half okay in center, but I really didn't understand actually the difference on how I would feel with more frequent therapy. And some of the differences that I can talk a little bit about is, I mean, I talked to you a little bit about, my medicine. I think for me that was a huge one, that I was able to get off some of the medicines for the high blood pressure medicine. I'm also able to have a more liberal diet, so improved appetite for sure, but even more exciting is more a liberal diet. I think a lot of us patients think about what you can and you can't eat when you're a dialysis patient, and because of the frequency of the therapy, you are able to usually have a more liberal diet. Obviously, you'd always have to speak with your doctor to see what your labs are, but I was able to increase that. Although strangely enough, I always still have the dialysis diet in my head, and so I'm still always careful, even though I know I can probably eat more, and I do. Definitely more energy. I mean, that has changed like 100%. I talked to you a little bit about recovery time. I mean, I go to the gym, I go on walks. I have 2 boys that are 11 and 13 years old. If anybody knows boys in particular, they're very active. They keep me busy. I'm working full-time. I do dialysis 5 days a week. I mean, I think I have more energy than the average person next to me who's not on dialysis. So I definitely think that doing more frequent gives you lots of energy. My sleep quality has definitely improved. I think, again, a lot of it has to do with like the restless leg syndrome that some patients get when they're doing in-center dialysis. I was definitely one of them that had that, and so sleep could be difficult. By doing more frequent, I don't have restless leg syndrome at all anymore. And so I'm able to do, the way I do dialysis is I usually do it in the evening. So I get on the machine probably around 7 o'clock at night, and I do my treatment, and I pretty much go to bed normally like everybody else. I go school and work. I mean, I was someone that always worked, but I feel like I've taken even more on since being able to do more frequent. Really, in general, my life has changed. I think my husband is very happy that I'm doing more frequent. I mean, we definitely have a very normal, active, social life, sex life, you name it. I don't think people would know that I'm on dialysis unless you looked at my arm, right? My fistula, I guess, is a little telling. But other than that, I would say that I'm just like everybody else, a normal, everyday person. Plus, I do dialysis. And it's a chronic illness, but it's an illness that I manage. And I think that's the difference, is when you're in center, it's not the patient that's managing, right? I mean, everybody else is doing everything for you. And so now being able to do it at home, I'm managing my chronic disease. And not only am I managing, but I'm able to live with it, a normal life. And that's really very powerful for a patient. We talk about empowerment. This is where you get your empowerment, when you're in control of your own destiny and your own disease.
And certainly, while not every patient receives the same benefit, but we see the majority of them doing what you see here on this slide, are results of multiple studies of many patients on home dialysis. So what Vanessa is talking about is shared by many of our patients. And Vanessa, I know you talk to lots of patients. I assume that's your assessment as well?
Absolutely. I mean, speaking to all the patients that I speak to, I mean, honestly, within a week, so many patients are emailing or calling, thank God I spoke with you, because they feel those results right away. Sometimes it can take, and again, everybody is different, and everybody has different speeds as to, how they will feel results, et cetera. But it is important to note that, you will start to feel those results, and it is a process and something that you have to undertake, and it's a huge learning curve. I don't want to pretend that this is so easy, because it is a learning curve, and there's a lot of training that goes with it. But the training and all the processes that goes with it totally outweighs the feeling that you're going to feel at the end, which is, again, feeling well, having energy, appetite, sleep, lower medication, like all these things that I felt personally that a lot of other patients also experience as well.
That's excellent. And while we're talking about dialysis, everybody has different lifestyles and different desires. And the point is, we have a therapy, hopefully, that's easy enough to do that we can improve access to almost anybody with end-stage renal disease. So, Vanessa, you dialyze during the day, and your husband is your care partner, so you're with somebody at all times. And I know you're looking now at some of the benefits of dialyzing while you sleep. It's important to note that even with hemodialysis and large needles in your running blood to and from your body, you can sleep safely and do dialysis. And with the Next Stage System 1 and adequate training from your dialysis crew, nocturnal dialysis is a reality, which means, if you're busy working all day long and you just don't want to come home and do it in the evening every day or before work, nocturnal will free up the day completely. Nocturnal will also get rid of your need to take phosphate binders completely. So it has distinct advantages for patients that they should discuss with their physicians. And then the other thing we should at least touch on is the fact that you can actually do home dialysis during waking hours without a care partner. The FDA has looked at the question of risk versus benefit, and after talking to patients that do home hemodialysis today, they realize that yes, there's probably a slight increased risk of doing dialysis without a partner, but patients are willing to take that risk because the benefits they receive from the therapy. So the Next Stage System 1 is not only cleared for daily dialysis as you do today, Vanessa, with the partner, it's cleared for nocturnal dialysis with the partner, and daily dialysis even without a partner. So somebody that lives by themselves can now be trained and take therapy home.
And I think that's such an important point because, again, this goes back to options and therapy, options for patients. Lifestyles change. And so, like you said, I started doing dialysis daily or more frequent, and I continue to do so, but I am in the transition now of being able to do nocturnal because I have found that that's the space that I think I need to be in now with working and with my kids, et cetera. But I know that there are options, and for whatever reason, I, God forbid, didn't have a partner, et cetera, I know that I could do solo. So I think that that's important because as we transition through life and your needs change, your therapy might change. So you might need a partner at one point. You might then not have a partner. You might end up doing solo because that's what you need for working, et cetera. Or then you might transition and say, no, I'd rather do it, during the day. And so as patients, we all have active lives, or we want to have active lives and be normal. And so to be able to have kind of options within the therapy is really huge. And again, I'm on 14 years and I'm just transitioning now to nocturnal. So, things can change at any time.
And from a physician's point of view, I think it's very important that you have, when you meet with your doctor or your care team, you have discussions about the difficulties of dialysis as well as the benefits of dialysis, and you discuss different options of therapy, because we find as a company at Next Stage that people that alter their prescriptions with their physician's consent stay on the therapy longer, meaning to me that there's communication. And I think that's the key to success of any therapy, is making sure your physician and your dialysis team understand the home therapies and that they're open and you're open with them so that changes can be made when that's indicated.
Absolutely. And I'm working with my care team now to make the transition over to nocturnal. And just like anybody else, I have to be, even though I've been doing it 14 years, I still have to be trained and make sure that I know the proper technique and have all the proper devices, et cetera, to be able to be successful in doing nocturnal. And so that is something that you have to work with your care team and have open lines of communication so that you can be a successful patient and be able to do it with the need that you need.
And so as we move on our journeys of renal failure, you've got to ask yourself, with any therapy, what's important to you? What do you want to get out of this? Whether it's quality of life, it's the ability to work, the ability to travel, whether it's quantity of life, what will it do to make you live longer, or the ability to stay out of the hospital. All of these things are important, and they're all important, of course, but you want to make sure whatever therapy you choose helps you get to the point you want to be in your life, and that's the discussion you should be having with your care team. So as we move to that, Vanessa is going to share with us a little bit more time. Vanessa, we probably have a good 8 minutes for you, or less if you wish, just to go over your story and let us know where you're at in your dialysis travels.
Absolutely. So thanks again. So you guys have heard a little bit of my story already, but I'm going to start you a little bit at the beginning. So I lived basically a pretty normal life all the way till I was about 12 years old. And then at 12, I had to get a blood test that you would get for school. And in the blood test, they found that I was highly anemic. And so the doctor started to perform some exams to see, well, why was I anemic? Was I internally bleeding? Was something else going on? And so needless to say, I did a bunch of tests, and it was found that it was going into kidney failure. So I had literally nothing letting me know that I was going into kidney failure. I didn't go to the bathroom more or less, or have any pains or anything that or feel tired or weak or diabetic, which are some of the symptoms that patients might have going into kidney disease. So I found out at 12 years old that I was going into renal failure, and at 12 years old, you definitely don't understand what that means at all. And as a matter of fact, I remember they told me that I was going to need a biopsy, and I thought that was an autopsy. I'm like, isn't that what dead people have? So I really was clueless. I mean, I didn't understand. Nobody in my family had kidney disease. So it was quite a shock to my family. We were able to maintain basically kidney function until I graduated high school. And then when I did graduate high school, I ended up having a kidney transplant from my mother. And that lasted for me about 5.5 years. And the reason that it only lasted 5.5 years, actually, some of the immunosuppressants that I was on at the time, unfortunately, ended up becoming toxic and actually ruining the kidney. And so I ended up losing my kidney transplant only 5.5 years into having it, which most patients, if they have a transplant which is through a family member, it's definitely usually longer than 5.5 years. But again, this is why we talk a little bit about everybody is different, and everyone has their own experience. So my experience was that I unfortunately lost that kidney transplant, and I ended up on dialysis. And I didn't understand what it meant at all. Nobody explained. This was, again, over 20-something years ago. Oh, no, excuse me, less than 20. No, 20 years ago. Nobody was explaining to me dialysis. Nobody explained that I would have to go 3 days a week at the same time each time, that it would be for the rest of my life. I mean, I thought I could go Monday at like 10 in the morning, and Wednesday I could roll in at 7, and Friday I could come at 9. So I didn't understand kind of the whole process of dialysis and how it would impact my life at all. And so when I did, I think that was really difficult for me. I was young. I was just in my 20s. All my friends were going out all the time and enjoying their first jobs, and I was always running to doctor's appointments, and I was running to dialysis. I actually had to quit my job, my first job that I had, and I had to figure out a way that I was going to get by. And I do owe a lot of strength to my mother, because she pushed me into volunteering and working and getting a different job where I could still do dialysis and also work, which is how I came into teaching. But it was not an easy journey. There was a lot of fear and a lot of hesitation. So fast forward, 8 years after being in center, I had met my husband, and we got married, and we wanted to start a family, and we did, and that's a whole other webinar that we could do, because I actually did surrogacy, so we could do a whole other webinar about that. But the point being is that I had this newborn son that I really wanted to spend more time with, and I felt like I was always running to dialysis, and anyone that is on dialysis now understands when I say, you run and you wait to get on the machine, and then I do my treatment, and then I get off, and I have to wait till I stop bleeding. So even though my treatment time was 3 hours, the whole procedure was more like 5.5, 6 hours. Plus, we talked a little bit about recovery. I didn't really feel so good afterwards. So it's not like I could come home and then go on a walk and go play with my newborn son. I was kind of just laying low. And I just wanted to find a better way. And back in those days, there were no webinars. There was no patient advocate that I could speak to. There was really nothing. And I think that I went on the internet. To this day, I'm not exactly sure how I found out about more frequent with Next Stage, but I did. And I called up a number which gave me a referral to a training unit that was doing Next Stage. So I actually had to end up leaving my doctor, my nurse, my staff, everything that I knew. I ended up having to leave in order to be able to do more frequent, because my doctor wasn't offering it. He didn't know much about it. The clinic that I was with didn't know anything about it. So I ended up leaving my doctor and my clinic to be able to train for more frequent. And I think one of the points that I like to mention is that even though I made that initial phone call, probably within the first month of my child being born, I actually did not transition over to more frequent with Next Stage for probably over a year. And the reason I didn't is because I was petrified. I was so scared of putting my needles in. I was also under the assumption of, why would I ever want to do more dialysis? What if there was an emergency? There was just a lot of fear and anxiety in my way. I had this newborn baby. I didn't know what it was going to be in terms of supplies. Where was I going to put the machine? I didn't have a big house. Where was everything going to be? And so there was just a lot of anxiety. But my determining and driving factor was this newborn baby, that I just was like, you know what? I need to get over my fear. And I should also mention that the reason I'm on dialysis so long is I'm highly sensitized, which means that I have very high antibodies, and it's hard for me to get a transplant, because I know a lot of patients ask why I've been on forever, and it's not by choice. But it really is out of need and necessity. And so until there is a better way, or my antibodies go down, and who knows what will be in the future, this is really the best choice for me. So that was my motivating factor. And I got over my fear, and one of the ways that I got over my fear that I think is so important to share with patients is I did what we talk about as a technique, which is the guided technique, which means that even before I started training for home dialysis, when I was in center, I worked with my favorite tech who knew my arm, and I started by first just watching, because believe it or not, I didn't even watch the process. I literally turned my head the other way for the 8 years that I was there, and whoever put my needles in would put my needles in, although I knew who the good people were and who the bad people were to put in the needles, so I made sure it was those people I knew. And I would turn the other way. I didn't even look. So one of the biggest things that I needed to do is I actually had to start watching the process. So I started by in center watching them put the needles in, and I probably did that for about a week or two. And then I started doing the guided method. And the guided method is when I would put my hand over the tech's hand. So he was actually putting the needle in, but he was guiding me and kind of teaching me the way to be able to put the needle in. And I started doing that guided method with him, just one needle at a time. And the nice thing about this and the benefit about this is that, I was in center still for a week, so there was no rush for me how to learn needle cannulation. I was able to do it on my own time. And I did that guided method for a couple of weeks. And then I transitioned over to being able to do one needle at a time. And I remember telling the tech, don't go anywhere. You stand right here. I'm going to do one needle. You better be right here with me. And he did, and that was like the confidence that I needed. And so slowly but surely, I started to be able to put my own needles in. Knock on wood, like to this day, that's what I do. I don't worry about infiltration. I mean, of course, there's always, there always can be a problem, but I have to say I think I infiltrated once in the 14 years, and really that's because I know my arm so well now. You know the spaces on where you can go and where you can't go. It's amazing the empowerment and how you feel when you're able to cannulate yourself. That's where all my fears were. So that when I was actually ready to train to do dialysis at home, I was ready to go. And so it's important to think about questions to kind of probe and discuss with your doctor about, transitioning over to be able to do more frequent dialysis, and think about how it pertains to you. So it'd be great if we can talk a little bit about those questions.
That's an excellent idea. I did want to reinforce the cannulation issue, because that clearly is a concern of almost all patients. Nobody wants to stick 2 large needles in their arm for dialysis, but you learn to do it, and you're trained well, and you find, at least most of my patients tell me, they feel more comfortable doing their own cannulation versus certainly some other individuals. And you brought out other couple things. We have to talk to doctors, and then we have to talk to our nurses. And these are 6 questions that are reasonable questions for every dialysis patient to ask. And you can ask this to your doctors, your nurses, your techs, your social workers, or your dietitians. They should be all trained, and if they don't, they should at least help you get to where you want to be. But you want to ask them, frankly, what dialysis therapy may offer the best chance of living a normal life, get you to the activities that you want to do, what's important to you, what are your what dialysis treatment allows you the best chance of survival, the longest chance of living. That's a very good question to ask, and certainly they should help you with that as well. Which dialysis treatment's best for your heart? And everybody's heart is different, and where you're at in your course, it may make a difference in which therapy I would help you with. What dialysis treatment option would you choose if you were faced with kidney failure? Now, some doctors are afraid to answer that question, but I think it's an important question. And if my dialysis provider wouldn't do in-center dialysis on him or herself, why then are they promoting it for me? So if doctor, nurse, whatever, if you had renal failure and you had to be on dialysis, what would you do is a very, I think, important question they should be willing to answer. And then the 5th question is, what more should I know about home hemodialysis? Because many of you, and that's, kudos to you, that's why you called in, there's this lack of understanding of home hemodialysis, and there are certainly plenty of ways to get more information. And of course, where do I begin? Let's not leave it with my question. Let's move to the next level. That's where frequently, in all facets of our life, we forget, where do we start? Because if we're going to make a transition, and we're going to explore things, you got to start somewhere. Vanessa, were there any other concerns with you with those questions?
No, I mean, I think some of the things to ask your doctor and think about is, in terms of survival and your future, where's the best place for you to be, and what are the survival rates, and why would you recommend one treatment over another, which is, I think, a very fair question. So maybe a doctor recommends PD to you, and that perhaps is a good space for you, but why? And so I think that we have to challenge ourselves and our doctors to understand our treatments better and to be better educated patients so that we know why we're doing things and not just necessarily go with the norm, but know what's right particularly for you. And that's where this should be a discussion that you're having with your care team to know what are those options particularly to you, because not everybody is the same. And I really always like to say that we're not all one size fits all, right? And so knowing that we're not all one size fits all, what is good for me? And what's good for me, Vanessa, might not be good for somebody else, but why? And so I would definitely encourage patients to ask those questions to their doctors and make it a conversation piece.
And I know time's getting short for some of you, so I'd be remiss. I've got to cover a couple things. One, we'll have this slide. It's going to be on the talk, so I'm going to leave it up for a couple seconds, but you can pause it to look at it more closely. But there are some risks of therapy, and it's clear that we shouldn't ignore the fact there are benefits but also risks. And there's 2 slides here of risks or of therapy. But of course, there's risks associated with all forms of dialysis. Certain risks are unique to home options as treatments are done without the presence of a medical professional. Nocturnal dialysis also presents its own unique risks, and full disclaimers are displayed here and should be considered. But if you have any questions or concerns about the options, discuss it with your physician, and you should be all options should be available to patients for the benefits as well as the potential obviating some of the risks. We do have a number of references that we quoted studies quickly, and I don't think they're important for us right now, but I just wanted to get them in case somebody wanted to go back. So I think we're open for questions, and Hillary, I'll let you moderate that if you don't mind.
Yeah, and so just a reminder, there's the chat box in the lower right corner where you can type your questions in, or if you're calling us, you can press *6 #6 to unmute your line and ask your question that way, and then *6 to mute it. So there's a question that came in that says, are you using the NX Stage 1 machine? I believe that's for Vanessa.
Yes, so I am using the NxStage System 1 machine, and that's the same machine that I've been using for the last 14 years.
Great, and another question that came in. Oh, did you want to chime in?
I was just going to say, NxStage System 1's been approved for home use since 2004, and we still have patients that started on day 1 with when the NxStage System 1 was studied, even before it was approved by the FDA.
And another question that came in is, how do you increase patient interest that are doing in-center hemodialysis?
Well, I can take that first, and Vanessa can fill in what I've missed. But I think whenever you meet with patients, you should always be frank and honest, and you should take the opportunity to explore questions that are important for them. So I'm rounding in an in-center unit, and the patient, as we discussed earlier, is hypertension and hypotension, and we can't control things, and we know their heart is going to get bad or is already bad. That's the perfect time to discuss why increased frequency dialysis is better. If you're discussing month after month about phosphorus with the patient, I turn to the patient and say, I can get rid of your binders, and this is how we do it. And it is like every other journey, it's a journey. It takes time. Do not expect that, I round in dialysis unit once and everybody's going to go to home hemo. But I will be honest, when I would take over a shift from one of my partners in other dialysis units, I could move 20 to 40% of those patients, but it would take me about 6 months to either PD or home hemo. But it's just the opportunity when there are distinct issues that come up that you can say, sleep's bad, 6-hour recovery, we can make that go away. These are the things that you can do for yourself to make that go away, and we will make sure that home dialysis is safe. We're not going to send you home till you're safe and comfortable, and even when you're home, there's 24/7 backup from both nursing, physicians, and industry for issues that might arise. Most patients just want to know that they're doing the right thing and they can do it safely.
And I'd like to add another great way is 2 things. Number 1, I think you need to set real expectations for patients so they really understand what's entailed so that they can be successful. And so that point in terms of increasing kind of awareness and interest for patients, I always really believe in advocacy. And so I think for a patient be able to speak to another patient that has been successful with home dialysis is a great opportunity to learn and kind of ask the questions from a patient-to-patient point of view. So I'm a big proponent of advocacy and getting advocates in there to speak with other patients.
Another question that came in is, my husband has not started dialysis yet. He has both peritoneal and hemocannulus in place. He has already a heart condition. We are leaning towards the peritoneal, but would the hemo be better?
So that's an excellent question, and I'm not going to turf it completely, but clearly this is one that you should have a frank discussion with your physician, your nephrologist about. Peritoneal dialysis is a perfectly good therapy for many of our patients. The benefit of peritoneal dialysis is while you still have good residual renal function, it clearly has a better place of keeping that. But keeping volume control, blood pressure control, and impact on LDH is not quite as good as home hemo. So it's a matter of sitting down with the individual patient and, frankly, making sure what you can do. And as we discussed before, you can start with peritoneal dialysis, which many of our patients do, and then as you need to, you can convert to home hemodialysis later as well. So it's a matter of prioritizing a lot of things that I don't have in front of me. I'd like to know how thick your heart was, how well it squeezes, those kind of issues, and then decide what's important for both you and your husband at home so that we could make these decisions. But that's an excellent question and one I would encourage you to follow up on.
Another question that came in is, I've heard of buttonholes. Can you explain what that is?
Do you want to take that, Vanessa, or you want me to?
Sure. Well, I'll give you the patient perspective of buttonholes, and then if you want to lead in with the doctor side, because I think this is really interesting. So there's usually two methods that you can cannulate yourself. One method is called the rope ladder method, and the other method is called the buttonhole, which is what you're asking about. So the buttonhole method is usually you're using a blunt needle, so it's a rounded tip needle, and you're basically building like a channel, like a canal, that you go in the same spot with the needles every time. I like to say that it's like when you have a pierced ear and you're putting your earrings in, so you put your earrings in the same spot every time. This is what you're doing with the buttonhole technique. You're building a channel where you're going in the same spot every time. Now, the things to think about when you're doing buttonhole is because you're scabbing in that one area, you essentially, and you'll be trained with your nurses, or you need to be trained with your nurses and your doctors on proper technique on how to remove the scab and then be able to go in the same spot. So buttonhole technique, I think, is a great technique. I know a lot of patients that do it. Particularly if you have a smaller fistula area where you're going. And so a lot of patients do that. But again, it's always up to your doctor to see what is the best method for you to be able to be cannulating, whether they prescribe the buttonhole or the rope ladder. The rope ladder technique is when you are doing exactly what it said, what the title says, which is the rope ladder, and you're going in different spots. So you start maybe down, and then you're going with the needles up, 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 and looping around again. I hope that kind of makes sense. So many years ago, we did a discussion on which is kind of the better technique, and really what we discussed is that neither way is the better technique at a conference that I went to. Just as long as you're following protocol and you're following aseptic technique, then, you know, doing the way that you're prescribed would be the best technique. So it really is something that is particular to your own fistula and your doctor to decide what's the best technique for you. But certainly buttonhole is a good method. I don't know if there's anything you want to add there, Mike.
No, I think that's excellent. The key is to do it, whether you do buttonhole or rope and ladder, to do it well each time, and cleaning your arm is not someplace to take shortcuts. So you want to do it exactly right every time. You'll be trained how to do it in your home unit, but you just every day is the same thing, just like a pilot. You do everything exactly right. And Hillary, I think we probably have one more time for Gina's question real quick. And it's how to go about training to start home hemodialysis and finding a doctor. Frankly, if your doctor is unknowledgeable or not willing to discuss it with you, the CMS mandates that they train all patients or educate all patients on home dialysis options, and they provide it even if they don't do it, meaning send you someplace else. Now, that being said, sometimes that you have to change your relationship. Google is not a bad tool. If you just put home hemodialysis in your city, it will pop up with the physicians that at least have some knowledge of it. You can go to your dialysis unit and ask them if they don't do it, where they send their patients to do it, and which doctors do it as well. You can call your renal network. They're a good support. So there are lots of places to get some information. And get some help with that. Nextstage.com has a place that tells you what dialysis units use it. So there are.
We also have, just to also, to add to what you were saying, Dr. Krause, is we also have on the Next Stage site, you can actually go in and find a referral center, or you can even speak with a patient consultant. And patient consultants are people like myself, basically, that have either done dialysis before with Next Stage or were former care partners. They might be transplanted now. But you can go to the website, the nextstage.com, and look for the patient consultant piece to be able to call and speak directly with the patient consultant or even email with them. Then they can help with referrals and some of those questions as well. We have the number. It's actually 1-888-200-6456. And if you didn't get it, I wouldn't worry, because you can always go to the nextstage.com and find it under find a patient or patient consultant.
And that's excellent information I didn't even know. Kathy and Hillary, Vanessa, and I are very happy to have done this with you, and we thank you for allowing us to spend some time with you this afternoon. I appreciate all the assistance we've had coming up to this, and I look forward to continue working with DPC.
And
thank you so much.
Dr. Stark. Thank you, Vanessa. We certainly have appreciated your sharing the past hour with us and sharing your information. And for everyone on the call, we will have the session recorded and the slides available to you. So there's a lot of information that was presented, and feel free to come back to the website and take a look. Again, Dr. Krause,